'Tis the season for coughs, chills, and sneezing. But why is it always in the winter?
It probably has to do with the drier air crowding and maybe the cold effects on our respiratory tree and our immune systems.
And why dry air? Because the dry air makes it easier for contaminated water droplets from coughs and sneezes to travel freely, this can cause more infection. So what infections are we talking about? Well, COVID hospitalizations may be down this season, but those viruses are still spreading, with the CDC seeing a jump in COVID, RSV, and the flu. It seems like everyone is talking about RSV, or respiratory syncytial virus, the most common respiratory cause of hospital admissions for children. In fact, 97 to 99% get this illness by age 2, but only about 3% end up in the hospital. But children aren't the only ones affected.
Up to 10,000 adults actually can die from RSV. Are we seeing more than what we would normally be seeing, or is this still part of that post-COVID kind of, we need to pay attention to RSV phenomenon?
I think it's a combination of things. Whether RSV is really an increasing problem or whether it's increasing awareness is not clear, but we do have more tools at our hands.
Those tools include testing and vaccinations, which are available to children, those who are immunocompromised or pregnant, and the elderly. Experts say if you're around those vulnerable and feeling sick, you should test. That's because while RSV usually mimics the same symptoms of the common cold, in severe cases, it can cause the inflammation of the lungs or pneumonia. That can lead to hospitalization, with all of these respiratory viruses potentially leading to post-viral fatigue syndromes. These include long COVID and long cold. Another reason why prevention is key: long COVID can happen at any time.
It doesn't always happen with just the first infection. It can happen after a second or third.
And one of the more common infections we see every year, bronchitis, is a lower respiratory infection, or what's commonly referred to as a chest cold. People usually mean acute bronchitis caused by a viral infection. This usually goes away on its own. But there's another form of chronic bronchitis caused by a bacterial infection. So how do you know which one you have?
Chronic bronchitis is something characterized by much more persistent symptoms and is often found in people who are a little older.
Bronchitis is considered chronic if someone has a mucus-producing cough at least 3 months per year, 2 years in a row. While symptoms for all these viruses can feel like the common cold, rhinovirus or adenovirus, it's important to keep in mind that they can make others more sick and are contagious.
If you're already having symptoms, think twice about going into a gathering. There are masks that we can wear more comfortably and for longer periods of time. Just being thoughtful about how we manage risk is probably the most important thing we can do.
Great. And obviously never to forget the old-fashioned washing your hands and not touching your face and things like that.
Yes, absolutely.
Yes, washing the hands in the middle of winter season, Dr. Azar, my favorite for the chicken cutlets that my hands become. So let me talk to you about this. When somebody comes in, they've got a cough. How do you, as a doctor, how do your colleagues make the distinction between all of these kinds of viruses? And does it really ultimately matter, right? Like whether you have, let's say, RSV or the flu, you don't feel good. I mean, help us understand that.
Yeah, I would say, like, the big picture, if you have mild symptoms, runny nose, a little bit of sore throat, maybe a low-grade fever, no, it probably doesn't really matter what it is, Hallie, unless you are in that higher risk group, medically high risk, you're pregnant, you are, you're a young child, maybe you were born prematurely, that kind of thing, then it does start to matter. And of course, there's nuances in the symptoms that we start asking and that kind of history that we elicit from patients, Hallie. But again, the ultimately to make a diagnosis, well, you can treat flu, right? We have antivirals. We can treat COVID. We can't treat RSV. So again, if the symptoms are mild, probably not a big deal. More medically high risk, and you really want to know so that you can institute treatment, yes, and you want to know.
What about vaccines? Because some people are not always eligible for vaccines in some of these instances.
Exactly. So, basically, Hallie, we know everybody 6 months and older should get the flu shot every year and can get an updated COVID booster. The two groups that I want to highlight are pregnant women. In addition to flu and COVID shots, anytime during pregnancy, they are eligible for the RSV vaccine between 32 and 36 weeks. And then, of course, we have the regular, now new RSV vaccine, which is indicated for individuals 60 and older, or anyone really, an adult of any age who is medically compromised.